Hi, thanks for tuning in with us. I'm Dr. Robert Berry, and I'm an orthopedic sports medicine specialist. One of the common things that we encounter as orthopedic sports medicine specialists is joint pain. And there's many things that can cause joint pain. And injuries that we've had many years ago, sometimes when we were younger, can start the pathway to chronic joint pain. One of the things that causes joint pain is cartilage damage. Many people have heard about knee replacements, and often those knee replacements that people have later in life are as a direct result of cartilage damage that they had from sports or activities when they were younger. Well, one of the most exciting things that is happening in the field of orthopedic sports medicine today is cartilage transplant. Now, the benefit of that is we can actually put new cartilage in your knee, kind of think of it as resurfacing your joint, just like we talk about retreading a tire on a car. We can actually put new cartilage in your knee. Now, not everybody is certainly a candidate for that. Those that are overweight, we specifically look at those that have what we call BMI, and that is certainly a ratio of height to weight. Greater than 40 may not necessarily be the best candidate for that procedure. Certainly individuals that are younger, and usually we'll use 50 or mid 40s as a cutoff, are going to do better the younger they are. And the blood supply is certainly better the younger that we are. One of the things that we do with cartilage transplants is take cartilage from your knee. We take little samples and we can send it off to a lab where new cartilage is grown. And that's been, until recent times, the main way that we transplant cartilage, and that's what we call ACI, or autologous, meaning from yourself, cartilage implantation. And that was something that was developed in the mid to later 90s and has been around ever since. And recently we've developed new techniques, and that is where we actually can take some of your own blood, spin that down, where we get what's called platelet-rich plasma, or PRP is sometimes referred to. We mix that with a micronized cartilage matrix, and so this matrix allows for new cartilage from one's body to grow into. So what we would do in a damaged area of a joint is go in, and much like people have seen a lawn aerated, where people poke holes in the lawn in order to help to stimulate growth, well, we do a similar thing in your bone, or where the cartilage defect is. We actually are able to go into the joint. We actually stimulate by poking holes in the bone and then creating bleeding. Well, that bleeding helps to create what we call stem or mesenchymal resting cells, which help to differentiate into cartilage. Now, if we take some of your own platelet growth factors and we actually mix that with a micronized or a cartilage matrix, your body can actually grow new cartilage. So the exciting thing is that we do have the ability these days to actually create a, if you will, retread for your joint, and sometimes can prevent people from having to have early joint replacement. And while not every individual is certainly a candidate for cartilage transplant, it's certainly something that you can discuss with your surgeon and whether or not this is an option for you. Thanks for tuning in. I'm Dr. Robert Berry.